As we all know, patient safety is the number one goal for Apollo hospitals. As a surgeon, I would like to talk about two aspects of control and preventive measures for patient safety in our hospital. The first step would be intraoperative, wherein a patient is called in, the patient is checked so that it is the right patient. We have a timeout where we introduce ourselves, the staff introduces themselves, and we make sure that it is the right site to be operated on. The site is marked upon previously in the preoperative period itself. Once the patient is taken on table, the surgery is always done under aseptic precautions. What we have to keep in mind when we are doing a surgery is about catheters, it's about implants when we are about to close. Closure is always done by suture materials and clips which prevent and which minimize the risk of post-operative complications. As a cancer surgeon, the most common sites of infection are one, the suture lines when we have closed the wound, and secondly, the drains and the catheters we leave behind to drain the fluid that has to come out and not be collected in the body. We take special care to ensure that the drains are kept in situ in the correct position. We check if the airbags for the ICDs are kept in position so that there is no backflow or leak which results in infections. The main point of view for us as cancer surgeons, especially in my case, as most of my patients go in for chemotherapy post-operatively, we introduce an implant into the body of the patient called a chemoport. Now the chemoport is kept in a major vessel which goes into the heart, and the chemoport is the first implant that is very prone to infections. Two things what we do is to put the chemoport in OT under sterile conditions only. The checking of the port and the catheter implant is seen on table using a fluoroscopic machine. The catheter used is open-ended so that there are no clots post-op which might lead to infections. The catheter post-operatively in the chemo ward in our onco daycare is managed by nurses who are trained to take care of the chemoport. Thereby, we reduce the risk of infection. The main cause of a chemoport infection is by improper handling. Therefore, it is very relevant that the nurses, the doctors, the juniors who are using a chemoport for a patient day in and day out in the onco daycare are trained to use the chemoports well. Post-operative management of a patient to reduce infections starts pre-operatively. The patient is started on a dose of a broad-spectrum antibiotic. The patient's comorbidities are taken into concern here. If a patient is diabetic, we have to see that the sugars are under control before we take the patient up for surgery. The broad-spectrum antibiotics we use are continued post-operatively until the patient is discharged. Thereby, it reduces the risk of post-operative infection. If we see anything, any pus or any discharge coming from the wound, the patient is dressed immediately. The patient is asked to come back for follow-ups regularly so as to prevent infections post-operatively. The chemoports are handled in the onco daycare only and not in the OPD for access. Once the patient is discharged, at the time of discharge, the patient is taught as to how to take care of their drains, because every patient will be sent home with their drains on. If the patient comes back with any signs of infection, the patient is asked to report to emergency at the time of infection, even though it's at late hours. The patient is managed with antibiotics again, which are jacked up as in a stepwise step ladder pattern. Patient safety thereby remains our main goal in treating all patients who come to Apollo, to our department for treatment. It's not treatment alone, it's the entire well-being of the patient that is important to us. Patient's well-being and patient safety is not just our responsibility and our duty, it is yours as well. Thank you.